Since spring of 2020, Intermountain Healthcare has reported patients coming into the hospital with what is being labeled as long COVID. These are COVID-19 patients who have persistent symptoms 3 months or longer after their initial infection.
And many of these patients aren't even hospitalized, do not even have bad infections, but yet they have ongoing symptoms. And the symptoms so far described in the literature, somewhat upwards of 2,000 symptoms, but the most common is profound fatigue, brain fog, shortness of breath, coughing, heart racing, and there's many, many other symptoms.
I would add chest pain to the litany of symptoms that Dr. Harris described as being one of the things that's most common, as well as some neurological zingers is what people call them, along with their brain fog. And many of the patients I've seen back at this point have really started to recover and started to improve.
We do have some patients with some unusual complications that can affect the lungs that both of us are seeing, which is they get this organizing pneumonia type thing that it inflames the lungs, and that usually shows up 3 to 6 weeks after the infection. Typically, the blood clots we're seeing usually come in within a month or so after infection. So those are kind of things we see. The things I tell patients is to really listen to their body. This is not a typical cold. You have to listen to your body.
According to Intermountain Healthcare, some studies and surveys show that between 30 to 50% of people infected with COVID continue to have bothersome symptoms for months, even though the virus is no longer in their bodies. The patient in this video at LDS Hospital in Salt Lake City was moved from the ICU to the COVID unit for recovery. Typically, if patients aren't too sick with COVID, they recover within a couple of weeks to a few days. But there are those whose symptoms continue to linger.
What I have personally seen is a lot of healthy people who don't have pre-existing conditions, a lot of athletes, a lot of fully working individuals who the fatigue and the brain fog is so profound that they're not able to get back to their pre-COVID degrees of exercise and activity. And that has been a little bit more different for me than I also see patients who are either hospitalized or in the ICU with COVID. And many of them are recovering a little bit more quickly back to their pre-healthy or pre-COVID state.
Many of them are younger. And more females than males, but I certainly have seen a fair share of male patients with this. And just like Dr. Hirschberg said, these are people who didn't have risk factors, not diabetics, not hypertensive, doesn't have coronary disease, never got very sick with COVID, but yet, they had fevers, chills, headaches, the whole works when they were sick with COVID, but it just lingers. All these symptoms continue and continue.
Intermountain Healthcare has set up a new long COVID navigation program for long haulers who continue to experience symptoms long after infection. The program will allow patients to be referred to resources or specialists who can follow up and address their ongoing medical issues.
So the Navigator program really was started to try to bring in all of these multi-specialties and get the patients to the right place in a quick time frame. A lot of our subspecialty clinics are booked out typically, and this is a way to get people in either to see me, Dr. Harris, or the other subspecialists rather quickly.
So just to kind of give you an idea of who's been on the team, certainly the pulmonologist, but also the cardiologist, the rheumatologist, the neurologist, the Live Well team, the physical therapy team, the rehab team. So it's a huge multidisciplinary approach.
Researchers estimate that 100 million people worldwide have experienced lingering health conditions or are still reporting problems following a bout with COVID. They could be considered COVID long haulers.
We're collecting data for ongoing research. We're also part of an NIH study going on with long COVID. And Again, this is a learning process, and we're working to best serve our patients and get them to where they need to be.
Nothing has been solidly proven as of yet to reduce or resolve long COVID. There's some really interesting new studies out there one hyperbaric therapy that suggests that that has some promise in the sequelae of long COVID.
Both doctors said maintaining good sleep and self-care aids in recovery. However, they also continue to push the vaccines.
I've seen patients who had long COVID and then got vaccinated and are still trying to get rid of some of their symptoms, but I have yet to see somebody with long COVID who was vaccinated first.
Risk of long COVID is, depending on which study you read, it drops markedly if you've been vaccinated.
For more information on the long COVID program, contact IHC. Melissa Anderson, Community Education News.